There's significant evidence out there that there's a mental health crisis throughout the entire country, and it has particularly impacted children, adolescents, and their families. The mission of Bradley Hospital is firmly anchored in the belief of providing excellent care to all those who need it, regardless of ability to pay, diagnosis they present with, while training the next generation of providers throughout the country and doing robust research to improve the type of care that eventually is provided to all. What makes Bradley Hospital unique is that as the first child psychiatric hospital in the country, we've had an extended period of time to create what is a unique continuum of care, of services that doesn't exist anywhere else in the country, and combine that with a long history of academic excellence, both in teaching of new residents, fellows, and psychologists, as well as a very robust federal research program.
Bradley Reach is an entirely virtual partial hospitalization program. We're serving kids 12 to 17 years old who are dealing with mood disorders, anxiety disorders, suicidality, and family issues. Bradley Reach is helping to build innovative solutions regionally by providing increased access to care for our usual catchment area in the New England area. And they're also expanding nationwide. So we're forming partnerships with academic centers and community centers across the nation to work together to identify specifically what each community might need. And as we're doing this process, learning that things look different in different states.
Partnerships like the one between Bradley and Boston Children's are incredibly important because it allows us to maximize the impact of the limited number of providers for the kids that are in really high need. Without partnerships and without collaboration, we also won't be able to understand the best possible treatments and the best possible approaches to managing the increasing severity and the increase in psychopathology that we're seeing in our young kids. So these are crucial for our ability to both rethink and reimagine child mental health and to provide good support to children today.
Because of the Bradley Reach program, we're able to bring the world-class cutting-edge research body of thought that informs the Bradley Hospital IOP and PHP programs to the kids of North Florida. We've never been able to do anything remotely like this before, and it's very exciting both in terms of the partnerships that we build and the care that the kids will receive. It's what kids really deserve.
The integrated care program between Hasbro Children's Hospital and Bradley Hospital has a few main components to it. For kids that present to us with the kind of medical or physical complexity that we're talking about on this service line, it's really critical that the care and the approach to these kids be both integrated and family-based. By integrated, what we mean is that providers across disciplines are meeting together to discuss these patients on a regular basis in a team rounds format in order to ensure that treatment across all modalities is focused on the well-being of the child. On the family-based front is that we're approaching every single one of our patients from the perspective that the two most important factors with regard to restoration of their health are family beliefs about illness and relationships in the family. If we conceptualize treatment as being focused on those two factors primarily, this is where we see the most fruitful results in the work.
We have a large multidisciplinary team working out of Bradley Hospital's Access Center, Hasbro Children's Hospital Emergency Department, and Gateway Healthcare. And KidsLink is housed within Bradley Access Center, and it's our call center. It's a behavioral health triage service and referral network. First and foremost, when you call KidsLink, what you're going to get is support because it is very stressful to be trying to manage these situations when you're with a child in crisis. So there would be a triage to determine risk and what exactly is the psychiatric need for that child. And if possible, we try all the time to connect the child directly with the level of care that they need.
Here at the Met, we utilize KidsLink when students are identifying they're having thoughts of suicide. So typically if a student is saying that they have thoughts of suicide, the adult that hears that information will get a hold of the social worker, and I will do a suicide prevention screener. And then after I do the prevention screener, I reach out to KidsLink for next best steps. Knowing I have access to clinicians at KidsLink has really helped when making the hard decisions on how to help students that are having thoughts of suicide.
One of the things at Bradley Hospital we strive to accomplish is to move care as close to the child and family in their home as possible, to get it away from the hospital setting, away from the emergency room setting, even away from the physician's office setting. I think that that's what's going to be important in psychiatry in the future, in child psychiatry, and I hope that that's something that we as a country can strive to do more thoroughly and more effectively moving into the future.